The Secretary of Health and Human Services faces her critics on Capitol Hill this morning. Kathleen Sebelius testifies at a congressional hearing on the Affordable Care Act and the problems with the health care website.
Millions of Americans say this new law is forcing them to pay more for health insurance. White House officials say Americans will pay an average of $328 a month. That's for mid-level coverage. CBS News business analyst Jill Schlesinger is looking into those prices and what they may mean for your family. I know you've been looking very hard. What are you finding, Jill Schlesinger?
Well, you know, it really does vary how much you're going to pay. It varies on how much you make right now, where you live, and what type of insurance you choose. So the pricing is all over the place from state to state, and you can't even, that average is sort of a silly number because so many people are paying above or below that.
Are most people going to have to pay more on this plan?
No. So here's how it breaks down. About 38% of the people who are uninsured will fall into a category where they would be eligible for Medicaid. That's for poorer people, right? Mm-hmm. And for some states, they have accepted dollars to expand their Medicaid programs. Then there's another 51% of people. Those people will get subsidies from the government, and they should be able to pay sort of a reasonable amount and probably less than what they're paying now. It's the 10% who are getting slammed. These are people who make more than that level at which you get a subsidy. So, for example, this is a family of four that makes more than $94,200. Those people are going to pay more for insurance across the country.
Can you explain? We've been reporting first, and Jan Crawford has, about how many people will have to pay more insurance. These are people who are individually insured. Why will they have to pay more? Because their current plans don't meet the minimum requirements required by Obamacare, right?
Absolutely. And many insurance companies have for years been able to offer these very interesting kinds of insurance plans. They say you're going to pay a huge deductible. You've got bare bones coverage. If something really bad happens, we'll cover you, but we're not covering your doctor's visits. Under the Affordable Care Act, there's a minimum level of coverage that needs to be offered. So an insurance company is basically saying, to offer that minimum care of coverage, I have to raise your premiums.
So can I just stop you right there? Because I saw the Aetna CEO saying, look, yeah, we're going to have to cancel a lot of plans because they're minimal plans. They don't meet the requirements by the Affordable Care Act. So do insurance companies, healthcare companies make out huge under this law?
It's hard to say. I mean, there's also going to be a huge risk for these companies because unless you can cherry pick young, healthy people to be part of your insurance plan, then you have huge risk. Remember, no discrimination based on whether you're a man or a woman or existing conditions.
How serious is the risk that enough young people will not sign up?
I think there's a huge risk. I think that this
plan,
if they don't, there is a huge risk that this plan goes down the tubes.
The Affordable Care Plan goes down the tubes.
Absolutely. I've talked to 3 different actuaries at big insurance companies. They are running their numbers, and the numbers are predicated that young, healthy people sign up for coverage. Remember, all insurance is based on large pools of people. If we're not going to say we can exclude older, sicker people, then younger,
young
healthy
under the
people.
age of 30? What is young?
Young is basically under the age of 35, we'll
35,
say.
okay.
All right, Jill, thank you.